Tight, achy, even painful muscles are a hallmark of almost every single chronic pain condition. But they're not just a side effect. They actually offer us really good information as to what's going on in your body. You can help tailor your treatment plan, but only once you understand what's actually happening. Muscle contractions begin in the brain, either as a voluntary thought or an involuntary action, such as when we are testing reflexes. So nerve signal goes from the brain down your spinal cord through the nerve roots to the muscle where it releases the neurotransmitter acetylcholine. Now, this is an oversimplification, but after acetylcholine is released, there is an influx of calcium to that muscle. Calcium binds to a molecule called calmodulin, which initiates that muscle contraction. Your muscles are broken into tons of tiny little fibers with actin in the red and myosin in the purple here. When calcium binds to calmodulin again, we get a shortening of those actin filaments. So it's actually doing this. That shortens the muscle. Now, as long as that calcium is bound to calmodulin, that muscle will stay contracted. In order for that muscle to relax, we need to kick off that calcium and replace it with a magnesium. This is why we always tout magnesium as being nature's best muscle relaxer. It kicks calcium off of calmodulin, allowing that muscle to relax. You see those actin fibers start to separate again, allowing that muscle to lengthen. So there are tight muscles, but then there's also trigger points. And a trigger point occurs when not all of those actin filaments fully relax. So you see in the middle here, some of those have stayed partially contracted. And this concentration of muscle contraction with relaxation around it is what results in a trigger point, or what you might refer to as a knot. And you can physically feel that as like a bump in your muscle. Now, trigger points are painful because there's a lack of oxygen to that area. So again, in order for that muscle to relax, it needs magnesium, it needs oxygen, and it needs ATP, which is your energy molecule. And all of that comes through your blood. But if these muscles stay contracted, what happens is they use up all of the oxygen, magnesium, and ATP in that blood, but it doesn't allow new blood to get in. So those muscle fibers are being saturated with what I call old dirty blood. It's devoid of nutrients and full of metabolic waste, keeping that muscle contracted. So we need to get more blood into that area. And that's why you have the inclination to press on trigger points. You're literally trying to squeeze that old blood out of the area to allow space for new blood to come in with magnesium, with oxygen, and with ATP. But anytime that a tissue is devoid of oxygen, it's going to scream out in pain. Think about how painful it is to hold your breath. This is what's happening around your body in your tight, achy muscles or the tender spots associated with fibromyalgia. They're simply just lacking oxygen and ATP to allow that muscle to relax, and consequently causing pain. Under normal circumstances, a tight, achy muscle is the result of a muscle that's been overworked. But with chronic pain conditions, tight, achy, even painful muscles are the result of a tissue that just can't fully recover. And make sure to refresh yourself on my last video about how muscles contract, relax, how trigger points form. But remember, this is a nice, healthy, relaxed muscle, and this one is contracted. Now, biopsies of chronically tight muscles, trigger points, and even the tender areas of fibromyalgia sufferers consistently show that there's an elevation in bradykinin, which is an inflammatory mediator of the inflammatory cytokines, tuberous necrosis factor alpha, interleukin 1 beta, 6, and 8. But there's also an increase in substance P, which generates pain, and CGRP, which under normal circumstances helps maintain proper blood pressure, helps maintain tissue healing. But if that peptide becomes too elevated, it creates pain, especially migraines. And this is why CGRP inhibitors are a popular treatment for migraines right now. But with the lack of oxygen to this tight, achy muscle, we also start to develop acidosis. So the inflammation is one thing, but acidosis also contributes to that hypersensitivity of your nerves, which creates pain. Now, if this is describing you and you have chronic pain, the name of the game is not to move less or move more. It's that we actually need to find a way to get more blood to these tissues. We need to increase the nutrients like magnesium and oxygen. We need to boost mitochondrial production of ATP so that we can relax your muscles. But we also need to clear out all of this inflammation and fix this acidosis so that your nerves aren't in a hypersensitive state anymore and they can react a little bit more appropriately. Now, this is all stuff that I've covered in previous videos, so go back, watch those, and now you can apply it to your tight, achy, and even painful muscles. Muscle pain is not always because you overdid it. Sometimes it's because you're actually not moving enough. Now, your muscles have different types of fibers that get recruited for different reasons. For endurance tasks, such as holding a certain posture, we recruit small muscle fibers. So think of professions that require you to be hunched over for long periods of time, like a dental hygienist, or even if you have a desk job, or even if you're just chilling on the couch watching TV for a couple hours, you're recruiting those small muscle fibers. Now, here's the thing. Those muscle fibers are the first to get recruited and they're the last to be released. So during prolonged periods of this low level activity, those small muscle fibers never get a break. If you're suffering from chronic pain, researchers actually call this the Cinderella hypothesis. One, because these small muscle fibers, they're always working. But two, we have to find that perfect fit of movement because too little movement and too much movement both increase your pain. But something right in the middle is actually going to help alleviate your pain. You see, the human body was designed for movement variability, not prolonged periods of static tension. So if tight, achy muscles become chronic and trigger points start to form, your brain starts to view those muscles as a threat, as an area of danger, and it responds in the only way it knows how to get your attention, which is by producing pain. This is just one of the many ways in which pain actually becomes chronic. Many practitioners will have you believe that your stress, anxiety, catastrophizing thoughts around your chronic pain are just a side effect, when in reality, they're a lot more interwoven than that, and in most cases are actually contributing to your pain, especially muscle pain, tightness, achiness. Now, chronic stress and anxiety activates your sympathetic nervous system, which increases muscle tone. That's taking this nice relaxed muscle and providing it some more contraction. Muscle tone is a bit of a misnomer. People always think like, ooh, my bicep, it's more defined, it's more toned. When in reality, muscle tone refers to the constant partial contraction that your muscles are under at all time. This is a physiological adaptation we developed because if your muscles are fully relaxed, it takes a lot longer for them to contract. But if they're partially contracted, that rest of that contraction can happen a lot sooner so that we can use our muscles the moment we want to. Well, if your muscle tone is being driven by your sympathetic nervous system, you're preparing to either fight or flee from a situation. But if you're not doing either, then you're not using your muscles and they stay chronically contracted. And the more stress and anxiety you feel, the more muscle tone develops and the more that that muscle becomes contracted, whether you want it or not. This you're going to feel is like tension in your shoulders, your jaw, your low back, wherever in your body. So that stress increases all that muscle tone and guarding, which reduces blood flow. See the last couple of videos. So now we're reducing nutrients, oxygen, ATP to those muscles. That's going to increase pain. And oh, I bet you that pain is just going to create more stress, and this vicious cycle just goes on and on with no end in sight because we're treating the mental aspect of chronic pain and the pain itself as two separate entities instead of treating them as the same condition. Now, we've been talking a lot about the connection between tight, achy muscles and chronic pain, but what if it wasn't actually your muscles that were the problem? What if instead it was your fascia? Now, you might have heard of fascia or you might not have, but fascia is a connective tissue that helps reduce friction between the different layers of your muscles, but also between your muscles and your skin. Now, that's where the conversation of fascia used to start and end. Boom. But now we've understood that fascia is actually a biologically active and pain relevant tissue that undergoes pathological changes in chronic pain. Now, under conditions of chronically tight muscles, your fascia follows suit through a process called densification, where it becomes thicker, more fibrotic, and loses its flexibility, which results in more friction between those different layers of muscles. This densification, it's not just interfering with your muscle's ability to fully contract and fully relax. It actually creates more myofibroblasts, which generate sustained tension throughout your entire musculoskeletal system. Because while muscles start and stop at every joint, your fascia actually keeps going. You can have a train of fascia that goes all the way from your occiput all the way down to your feet. So you can have a problem here and it shows up as pain there. The problem with this mechanism is that it's actually independent of neural input. So up until now, we've identified two different ways in which a muscle can contract. Either consciously, you think it and that contraction happens, or unconsciously, as when we're testing reflexes, or if you're activating your sympathetic nervous system, which increases that muscle tone, and you start to shrug your shoulders and you don't even realize that you're doing it. This increase in myofibroblasts is now the third way that we can create a sustained muscle contraction. And when we do, we actually increase nociceptor activation, which creates more pain signals that go to your brain. Now, this myofibroblast generated tension in your fascia is one of the proposed mechanisms behind how a localized pain syndrome can become more widespread, such as in fibromyalgia.